In this chapter, we will demonstrate how to prepare the active heel traction boot prior to loading the patient, and how to properly load a patient's foot. First, I'm going to show you how the active heel traction boot should be prepared for surgery. Please note that the comprehensive hip positioning system instructions for use are shipped with the product and should be followed. Reference these instructions for all appropriate notes, cautions, and warnings. If this document has been misplaced, please call your local customer service department for a replacement. The IFU number is 106-00768, which apply to both the supine and lateral hip positioning systems. Before beginning, it is advised that you ensure the center strap buckles are passed through the loops on both ends of the heel strap. Start by ensuring that the boot is firmly secured in the boot connector. If loading the patient pre-operatively, place the boot on a flat surface. Next, unbuckle the boot's 3 front buckles if they are not already unbuckled. Ensure there is adequate slack in the calf and toe straps by adjusting each side where the strap feeds through the buckle. To prepare the center strap, place one hand on the cam buckle and your other hand where the strap feeds through the buckle. Press the release lever of the cam buckle and pull the strap and buckle with your other hand. Repeat for the other side. Lastly, position the heel pad so that the bottom of the heel pad lines up with the bottom of the calf pad. The boot is now prepared to accept a patient's foot. I'm now going to demonstrate how to properly load a patient's foot into the active heel traction boot. Before beginning, wrap the patient's feet with the disposable boot insert pads. These pads are designed for you to customize to the patient's foot size. To customize the pads, cut the excess padding from the boot insert pad and discard. Make sure the patient's feet are wrapped appropriately. Avoid any bunching of the disposable boot insert pad, which may cause undesired pressure on the patient's foot. Next, position the heel pad in the boot so that the bottom of the pad lines up with the bottom of the calf pad. Place the patient's foot into the active heel traction boot. Please be advised that to maintain foot flexion and minimize heel lift and slippage, you should ensure the patient's heel is set firmly into the boot's heel pocket. Confirm that the heel pad is positioned above the patient's heel and that the patient's foot is flat against the sole of the boot by examining the rear heel window of the boot. Next, buckle the calf and toe straps, ensuring that the buckle pads are directly beneath the buckles. With one hand, form a C shape and place over the center strap buckle and pad. While pressing firmly down upon the buckle and pad, pull one of the free ends of the center strap in the direction of the patient. Pull each strap end towards the patient's head until that side is tensioned. Repeat for the other side of the center strap. The pressure you place over the midfoot while tensioning each end of the center strap will help seat the heel into the boot. Ensure each buckle is centered over each pad, and that each pad is centered over the midline of the patient's foot. Boot straps should be tensioned enough so that the patient's foot moves only a minimal distance off the sole of the boot. Use the rear heel window of the boot to verify that the heel pad is above the patient's heel and that the patient's foot is properly positioned. Repeat this process for the second foot if the patient will be in the supine position. That concludes our demonstration on how to load a patient's foot. Please refer to the instructions for use for all other instructions related to this system. Again, the IFU number is 106-00768.